So today's webinar speaker is Dr. Trevor Cates. She will be discussing hormones and how they impact your health. Next slide, just for some housekeeping before we get started. So everybody here is in listen-only mode. There is a Q&A function on Zoom. So if you have any questions during the course of the webinar, please use the Q&A just so we can track your comments and make sure that all the questions get answered. If you're having any issues during the course of today, please email us at info@aanmc.org, or you can send a chat message to me as well. Next slide. And so we're just going to put up a quick poll here just to see who is in the audience. Next slide. And so with that, I'm going to introduce our speaker today. So we have Dr. Trevor Cates. She is the author of USA Today bestselling book, Clean Skin from Within, the founder of the Spa Doctor Natural Skincare line. She was the very first woman licensed as a naturopathic doctor in the state of California, and has worked in many spas all over California and Utah. Dr. Cates continues to help women from all around the world with a focus on skin and on hormones. She's been featured on various different TV shows, including The Doctors and Extra TV. She is the host of Hormones, Health, and Harmony docuseries, the Women's Doctor podcast, and public television special, Younger Skin from Within. Her next book, The Natural Beauty Reset, the 7-day program to harmonize hormones and restore radiance, is available for pre-orders and hits the bookstores in September. And so we are so excited to have Dr. Cates with us today and to talk all about hormones, health, and how to stay healthy naturally. And so I'm super excited to have you with us today. And I'm going to make my face go away so they can focus on you and this amazing talk that they're about to hear. So thank you so much for joining us.
Thank you. It's so great to be here. I love talking about hormones and skin, especially the two of them together. And there's so much we can cover on hormones. So I'm going to focus more today on hormones and skin, just because there's an important connection there I think a lot of people aren't aware of. So, but we're going to talk about how common hormonal imbalances are, the connection with our skin, some 5 hormones that, play a really big role in our health, and how these hormones change at different times in our lives, how to get hormones back in balance, and lifestyle choices that impact them, natural medicine options for hormone balance. So hormones and skin, I think a lot of people aren't as aware of the connection with hormones and skin. They might think of it with acne because of hormonal acne, and oftentimes people get a surge in acne around their puberty, or certain times for women, certain times of the month, or things like that. But there are a lot of other ways that hormones are connected to our skin. And so there's, of course, I mentioned acne, which is a very common connection, but also conditions like rosacea, atopic dermatitis, melasma, premature aging. Those are some examples of conditions where hormones play a role. And with a naturopathic approach to hormones and skin, we're always looking for the root cause. What is the underlying cause? And with skin, one of the reasons why I focus so much on it is because a lot of people and a lot of the general public don't really look at the root cause approach when it comes to skin, because the conventional approach to dermatology is typically around what you're putting topically on your skin and using topical steroids and things like that to kind of manage the inflammation on the outside. But what I really want to help people understand is how important it is to look at skin as an outer reflection of our overall health. And if you tuned in my last webinar I did here, I focus all about skin, and I talked about this. But, again, I want to focus on hormones today, how they play a role. So as I mentioned with acne, but hormones play a role, especially as we go through set changes with our sex hormones. But rosacea is another one that can be impacted by our by our hormones. And so rosacea is something that we definitely want to pay attention to. Atopic dermatitis is another one, or eczema, where especially considering it's an inflammatory skin issue, a lot of times what we're seeing is an increase in cortisol, the adrenal hormone cortisol, and that can worsen inflammatory skin issues like atopic dermatitis as well as rosacea. And also melasma is a common skin condition in certain times, and especially in a woman's life around pregnancy or when she's on hormones. And so we know that this is a common one related to hormonal fluctuations. And then of course, aging, when our hormones change with age, that can affect the way we age. And of course, aging is a natural process, right? But we never want to look older than we actually are, because that can be a sign that something's out of balance. Any of these skin issues are a sign that something needs to be addressed within the body. And so what can we do to address these? Then we also have other signs of hormonal imbalances that show up on the skin, because skin is oftentimes our early warning sign that something's out of balance. So, for example, one of the early warning signs of low thyroid or hypothyroidism is dry skin. So, of course, people will present with a lot of other symptoms. So, constipation and weight gain and fatigue, those are hair loss. These are some of the common signs of hypothyroidism. But one of the early signs of this can be dry skin. So, I think it's really important to remember that skin is our largest organ and it's connected to our body. So, it doesn't just sit on the surface of our bodies all by itself. It's connected, and hormones are one of the ways that it does play a role. So, hormones do impact our health overall, and I believe that hormones impact all women at some point in their lives. And for some women, this is an ongoing struggle. But for really, it's hormonal imbalances impact all of us. Because if you think about it, it's not just about our skin or about our sex hormones. A lot of people think about hormones as related to their cycles, like women's cycles or sex drive. But hormones rule so much of our health. That's why I wanted to do a whole 9-part docu-series on this, the Hormones, Health, and Harmony docu-series, because I wanted to really dive into all the different aspects and ways that hormones rule our health. And Dr. Yanaz is one of the experts that we interviewed for the docu-series, along with over 50 other experts that I interviewed for this, because I wanted to dive in deep and talk about things like metabolism, sleep, skin, our women's menstrual cycles, and fertility. Both it's both men and women can have hormonal imbalances that lead to fertility issues, energy, and there's just so much that's related to our hormones. And what we want to do is we want to be in charge of our health. And that's one of the really great things about naturopathic medicine, is that as doctors, we're helping our patients be their own best advocates. So we're acting as teacher and guide to help them on this path. And patients are able to really take control of their health. So education is a big part of this, and understanding how our bodies work. And so it's really great to come about it in this way, because unfortunately, we especially as women, we've been given a lot of misinformation about our hormones, or sometimes we're just not told things, or we're told just don't worry about it. It's just part of being a woman. Things like acne, period pain, PMS, insomnia, infertility are really common. But it's important for people to understand, just because they're common does not mean that they're normal, or that things that we should just suffer through. They're not just a part of being a woman. These are signs that the body is out of balance. So we need to do things to address the root cause. We need to support the body in getting back into balance, so that we can address things like like acne, period pain, PMS, insomnia, and fertility, and get ahead of them. And especially for women, as we go through major life changes. So maybe that's pregnancy or postpartum or menopause. Those are big transitions, or, for young people, puberty. And so if our hormones are in a balanced place, these transitions are not as hard. So you'll hear a lot of women say, oh, menopause is the worst thing ever. It's so hard to go through. Well, I can tell you that it doesn't have to be that way. I've interviewed so many experts, women that have just gone through it with ease, or maybe they had some issues come up, but then they were able to address it and then go through the rest of it in an easy way. Same thing with pregnancy. A lot of women are really struggling. And I've heard women say, who gets pregnant that easily anymore? But it's actually true that women can easily get pregnant. Now, of course, some women, it's going to be more, some couples, it's going to be more challenging than others, depending upon a number of factors. But for many people, it doesn't have to be a struggle. And these symptoms that women will oftentimes go through on a monthly basis. And every month, like, oh, here comes my period. I've just got to just stay home in bed, or I can't go do the things that I normally do, or I know I'm going to be really moody at this time, or I know I'm not going to sleep because I'm going to be feeling miserable at night. It doesn't have to be that way. And so I think it's really important that we bust these myths that women have to just sort of struggle through this. Now, of course, men have hormonal imbalances too. For women, it's more complicated. Our hormones are just more complicated because we are born with the ability to with the parts to give birth, to make babies. And so because of that, our hormones are just more complicated, and we have these menstrual cycles and other things that change throughout the month, as well as throughout our lives when we go through pregnancy, and if a woman gets pregnant, and then also with menopause, which is inevitable that you get to a certain age, it's going to happen. And for some women, having to have a hysterectomy, they'll go through surgical menopause and go through it even earlier. So we all have to go through this as women. It's just a matter of how healthy we can get and how much we can get in balance. Now, genetics does play a role in how we go through these transitions and a lot of the symptoms that we have around hormonal imbalances. Now, if these kinds of things run in your family, you may be more predisposed to this, but that doesn't mean that you're going to have to put up with it, and that no matter what, you're going to have to deal with it. There are many things we can do to change our genetic expression that will keep us from having the same kinds of issues that people in our family may have had. So that's the really good news. And again, a powerful thing about naturopathic medicine is that we can make lifestyle changes. We can use natural medicine to help change the genetic expression. So some women and some people have to work a little bit harder to achieve hormonal balance, but it's definitely possible. So I think it's really important to realize that. Oops, I'm going the wrong direction here. Okay. So I wanted to talk about some of the big hormones that impact our health and kind of dive into these. And Joanne, I meant to ask you beforehand, how much time do I have? I forgot to ask.
Oh, that's okay. If we could start wrapping up by about, on my time, I'm on Pacific 12:35, 12:40.
Sure. Perfect. Okay.
That'll leave us some time for questions.
Yes. Great. Thank you. Okay. Because I could go on for a really long time talking about these things. So I want to make sure I'm staying on track. So now these 5 hormones are some of the more common ones that impact our health on a regular basis. There's certainly a lot of other hormones that I'm not talking about here, because I do want you to remember how much hormones impact our health. So other ones that are not on this list, I'll just mention briefly, are things like melatonin that help with our sleep, ghrelin and leptin that help with our appetite, insulin that helps with blood sugar balance. These are there, and there, the list goes on and on. Our endocrine system is complex and it's absolutely fabulous when it's in a balanced place. But we, again, we just have to work on getting it in a balanced place. Now, all of these hormones, they work together. And so one will impact the other. So it's important for us to get in a balanced place. Some of the hormones are coming, they're triggered from hormones that are released in the brain, and then the endocrine, they're giving signals to the endocrine glands. So it's an intricate and complex process. Again, that's why I did a whole 9-part docu-series on it. But let's talk about these 5 hormones. So cortisol is one that comes up a lot in naturopathic practice. When naturopathic doctors talk to their patients about all of these, all 5 of these, quite a bit. But cortisol comes up a lot because it is one of our adrenal hormones. So cortisol is released by the adrenal glands in response to stress. Now, stress is not a bad thing. It is just that we need to know how to get the right amount of stress and how to manage our stress. So acute stress is common. It's a normal process, and it's actually not a bad thing because it just kind of gets our bodies going. But the problem is when we have ongoing stress, then that can really can create some damage in the body. It can wear out our adrenals. And so it makes it a little bit harder for them to function the way that they're supposed to. So this is quite common where we'll see people getting what some doctors will call it adrenal fatigue, or really it's an imbalance in our adrenal function. And so what we want to see, ideally what we see with our adrenal function is that in the morning, we'll get a cortisol surge. So we'll get a higher amounts of cortisol in the morning, where that'll help us get up and get going. And we don't need the coffee because we have our cortisol, and that kind of gives us this little boost in the morning. And then throughout the day, it'll start to drop as we get towards the evening. Cortisol will drop, and that drop helps is one of the things that helps gets us ready to fall asleep at night. But the problem is that it doesn't always work that way. So if we've been through a lot of stress, again, genetic susceptibilities can be a part of this, but really it has to do with lifestyle. So if we've lived a very stressful life, or we've been through some major stressors, our adrenal function can get compromised. So what I see in some patients is that instead of their cortisol getting that bump in the morning, it'll be flat. So they just don't get that cortisol surge. So these types of people will have really struggle in the morning getting going. They're really relying upon coffee and trying to get going, and they want to sleep in. And then and then with other patients, what I'll see is that cortisol in the evening doesn't drop off, and their cortisol stays higher. So with those people, then they have difficulty falling asleep at night because their cortisol is their adrenals are saying, hey, it's still time to keep going. And then with some people, their cortisol just goes flat. And so we'll do a cortisol test, which is usually either a urine or a salivary test, and we do it throughout the day. And with the salivary test, it's really nice because you can collect it throughout the day and you can see, is it high in the morning like it's supposed to? And is it dropping in the evening? But with some people, it'll just be flat all day long. And so depending upon where someone is on that pathway, there are different things that we can do to support adrenal function. So I'll talk more about that in a moment about naturopathic treatments. Just want to kind of first talk about how these are impacting our health. The second one on the list here is thyroid. And as I mentioned, low thyroid function can cause a number of symptoms. So low thyroid can cause things like dry skin or constipation, hair loss, fatigue, weight gain. So this can make it really challenging for people it really impacts our metabolism in a big way. There's also the flip side of that, where there can be hyperthyroid, where your thyroid is more active. And so that's basically the opposite of the symptoms. So your skin might be a little bit more oily, or you might be more acne prone. You might feel agitated and anxious, and your heart rate might be going up. You might have loose stools and And so things like that could be going on, might have difficulty keeping weight on. And then you also probably have heard of autoimmune thyroid conditions, which are quite common. So these are all things that can impact our health. The third one on the list is estrogen. And estrogen it is it's really important for women to give us our curves. It helps us with our fertility. It helps us with a number of things throughout our lives. And so, but the problem is not estrogen is not a problem. None of these hormones are a problem. They're all fantastic. The problem is when they get out of balance. And one of the things that happens we see oftentimes with women is there's an imbalance of estrogen and progesterone. So it's often times referred to as estrogen dominance. Now, a lot of times what's happening is not that estrogen is really, really high, but that in relationship to progesterone levels, that the progesterone is low and the estrogen is high in relationship. So that's why it's called estrogen dominance. So that can lead to a number of problems, especially problems with the menstrual cycle, heavy periods, painful periods, those sorts of things. So what we want to do with those, with women with these, is we really want to balance estrogen and progesterone. And then so at certain times in a woman's cycle, these fluctuations change, estrogen changes, progesterone changes, and then also throughout our lives. So when we get to be usually in our 30s, our progesterone levels start to drop in relationship to estrogen. This is this is actually the beginning of perimenopause. I think a lot of women don't realize that perimenopausal symptoms can actually start as early as like 35 years old, in our 30s. And that's not uncommon. So sometimes what we'll start to notice is changes with our cycle. We might start to notice differences with our sleep. Progesterone actually helps us with our sleep. So when progesterone starts to lower, then we might have a little bit more difficulty sleeping at night. We also might notice that we're a little bit moodier because of that drop in progesterone and relationship to estrogen. So that can be an issue there. So really it's about creating this balance. And there are things that we can do to support the body as we go through these changes. And then the fifth one on the list is, because I kind of talked about progesterone already, the fifth one on the list is testosterone. Now, both men and women have testosterone. Both men and women have all of these hormones, but we definitely think of testosterone as being more of a male hormone, and estrogen in particular being more of a female hormone, but men and women have both of these. Testosterone is actually really important for women as well. We don't need it to the level that men have it, that same level, but it is still really important for us to have testosterone. It is what gives us drive, not just sex drive, but also overall motivation and drive. It helps us with our muscles and our strength and drive. So testosterone provides a lot of important roles in our body. We don't want too much and we don't want too little. So some people will experience a condition called PCOS, and that is when it could be from a number of different things, but one of the things that we oftentimes see is androgen excess. So androgens are things like testosterone. We also can see changes with blood sugar imbalances with PCOS, but that is one of the more common hormonal imbalances that we oftentimes see in naturopathic practices. The good news is that there's a lot that naturopathic doctors can do to help support really all of these issues. And so I always want to point out that with a naturopathic approach, what we're doing is we're looking at symptoms. We're also looking at test results. So we do test results, and we look at the patients, their history, what their family history is. We also look at tests, but we never look at tests alone, and we never look at symptoms alone. We want to do both. And especially when it comes to hormones, because because hormones are so complex, it's really great to use tests to help confirm where we think we're going. Sometimes we can really tell, okay, I think this is cortisol and I think this is what's happening. But sometimes, like, for example, if someone has insomnia, a woman has insomnia, she's really struggling with sleep at night. Okay, is it cortisol or is it progesterone? She might be, 40 years old. And she might be under some stress. So, hey, it could be cortisol. It could be her progesterone is starting to drop, or it could be a combination of both. So it's better to kind of test with that along with looking at symptoms so that we can really hone in the best treatment. So there are so many patient studies cases that I could cover. I think one of the big ones that connects skin and hormones that people think about the most is acne. Acne is the most common skin condition in the United States. It is important for us to realize, though, that acne doesn't exist in some places in the world. And I remember when I went to Uganda a few years ago, I never saw any of the people there that we visited, never saw any acne in anyone. And I know that there are places like Papua New Guinea, they've never had a reported, there's a place there that there's never been a reported case of acne. Now, of course, the lifestyle that these people have is very different than the standard American diet, the standard living, the lifestyle that we live with a lot of processed foods and the ways that we manage stress and all of these sorts of things, environmental toxins, all of that can play a role. But it is something that we commonly see in the United States, unfortunately. So this is something that naturopathic doctors oftentimes will see acne, and all doctors, just because of the how common it is. And so the thing is with acne and with really any skin issue, if you struggle with skin yourself, you know how challenging that can be. I've had my own personal journey with skin issues and hormonal imbalances and the combination of the two, as well as acne. And anybody that's had those knows how embarrassing and how really debilitating skin issues can be, especially when they're on the face. And so I was thinking about this particular patient, this 27-year-old woman who came in to see me with acne. And not only did she have acne on her face, but she also had acne on her chest and her back. And she was so embarrassed by her acne. And even she didn't even want to get undressed. Like, she just didn't even want to be intimate with her husband because she was embarrassed by the skin on her chest. And she didn't want to wear a bathing suit in the summertime. She didn't want to wear sundresses. And so it wasn't just her face that she was concerned about. It was actually her body as well. So this was a significant case. And, with something, when it's that extreme, when you have more of a severe case of acne, it takes a while. You have to go look at layers of what's going on with the person. And it also takes some encouragement. I think one of the other things I love about naturopathic doctors is that we really take the time to listen to a person and experience empathy, where we're really listening to them in a way that we like, yeah, I hear you. And I know this must be really challenging for you because of all the changes, all the struggles that they've been through. And I think with conventional medicine, doctors oftentimes only get 7 to 10 minutes with a patient. So they don't have the time to spend talking to their patients, kind of reassuring, like, hey, I got you. And we're going to get through this. And so that's one of the really nice things to think about is being able to spend that time with a patient and guide them through. So with this particular patient, the first visit, it was a lot of listening, looking at what other lab tests that she had done. She also had a thyroid condition. So she had hypothyroidism and was taking medication for that. So I looked at the medication, I looked at her recent lab work. And then what he did is I just went ahead and said, okay, it's been a while since you've had your thyroid tested. Let's go ahead and let's check your thyroid, see what's going on with that. And let's go ahead and do a full hormone panel, find out what's going on with your other hormones, because she was having some issues with her cycle. Her cycle was kind of irregular. She was having some issues with that and some other hormonal symptoms. So we wanted to get started with that. I also noticed that she was having some digestive issues. So let's take a look at the digestion. So what I wanted to do was get her started with some dietary changes. So we started with things like cutting out sugar and dairy and gluten, some of the big trigger foods for acne. Sugar is a big one. And that is because when people eat sugar or foods that turn to sugar, what it does is it increases insulin, and an increase in insulin can increase androgen activity as well as sebum production. So that can trigger acne. So balancing blood sugar, cutting out at least the processed sugars, and talking about ways to reduce overall increase in blood sugar spikes was what I wanted to talk with her about. So the first visit, we did a lot of talking about her diet, her lifestyle, and also her skincare routine, because what we put on our skin is also really important. And there are a lot of endocrine disrupting chemicals in skincare products, hormone disrupting chemicals. So I wanted her to clear up, clean up, switch over to natural skincare products. I have my own skincare line, the Spa Doctor skincare line. So I had her switch over to that. But I also called in a topical, it called into our local compounding pharmacy, a topical that contains some herbs and things in there that she could use naturally as a topical. We had it made as a serum so that she could use it topically on her skin in between the steps of the skincare system. And so that's where we started. And I also started her on a probiotic and some other digestive support to get her digestion in a good place. So then when she came back, we had the lab results. We took a closer look. I ended up having to adjust her thyroid medication because it was actually too high. And so that was causing her to be more leaning towards hyperthyroid, right? Even though she was hypothyroid, she had too much. So we adjusted her thyroid medication and then looked at her other hormones and saw some imbalances there. So I put her on some herbs to help with balancing her hormones and really kind of helped her get back on track. So, it's one of these things in naturopathic medicine. You have to come in, the patient has to come back in, and we adjust things. We can do more testing. So then I did some gut dysbiosis testing to see what was going on with that. Then the follow-up appointment, the results came back from that. So we made some modifications, did some treatment to help address her gut dysbiosis issues. So it took us a few months to really get things in a place where her skin really calmed down. But even within the first few weeks, she started to notice an improvement in her skin. And that's always a fabulous thing when we start to see we're going in the right direction. And then we just encourage our patients saying, hey, look at the progress you've made. I know we're not all the way there, but we're getting there. And instead of just using a topical to suppress it or getting on a medication that might temporarily take care of it, but is going to create side effects, let's really try and address the root cause. And so doing that, she was gradually getting better. And within 5 months, she was so much better. Her skin was so much more clear that she had a better relationship with her husband because she could rekindle that intimacy and not feeling so embarrassed about her body. They actually had planned a vacation to a tropical location so she could wear a bikini, which she hadn't wanted to do for a while. So it was really reassuring. And then, of course, I recommended other things that she could continue to do to her skin because she had the acne scarring. So we wanted to do some things to support that. So then it became, it was like, what's the next step that we can continue to see our patients and support them? Because I'm always like, okay, well, you at 100% yet? And they're like, no, not yet. Or maybe when they are, then we're done for now until something else comes up. But I always want to make sure that we're doing everything we can because there's so much that naturopathic medicine has to offer. And so I feel like I skipped the slide here. So just to kind of go over some of these naturopathic approaches, we do want to start with lifestyle. And so as I talked about with this case study, I talked to her about her sleep. How's her sleep? And wanted to make sure that because getting a good night's sleep is crucial for hormonal balance. I can't emphasize this enough because I can't begin to tell you how many people have problems with sleep. And it shocks me all the time how many people who just say, well, I just don't sleep. And my parents didn't sleep, so I don't sleep. And they just think that it's just normal to not get a good night's sleep. And it's not normal. Again, it's common, but not normal. So sleep is essential. That circadian rhythm that we have, that cortisol, melatonin, and the progesterone, all these hormonal changes that help us sleep. These are crucial to get back in balance. And talking to patients about sleep rituals and ways that we can support and set them up for a good night's sleep. What do they have a bedtime ritual? If they don't, let's talk about that. I'm now wearing an Aura ring. So I just got this Aura ring. It's so interesting to get this kind of feedback. And so there are devices like this that we can use to monitor our sleep and our patient's sleep. So it really can help provide great feedback. The Aura ring, I don't have any association with Aura ring. I'm like enjoying it right now, but it also tracks like movement and things like that. We do want to talk about exercise and movement. These are really crucial. Mindset helps with stress management, and adrenals being such an important part. This is really important for us to address these. And again, as naturopathic doctors, we oftentimes have the time to do this. It helps for me. I have one book, Clean Skin from Within, and I have another book that comes out in September, Natural Beauty Reset, because I have books, I can give them to my patients and have them read them before they come in. So it's nice when you can get to that place. You're maybe not right out of the gate when you finish naturopathic medical school, but eventually writing a book, I could just say is such a great thing, because you'll notice there are things that you say over and over and over again. And a lot of them have to do with sleep, movement, mindset, food, toxin exposures, these sorts of things. And, that's always nice to be able to share. But in the meantime, feel free to recommend my books because they provide a lot of that. My book, Natural Beauty Reset, that's coming in September. It's a seasonal program. So for each season, sleep, movement, mindset, skincare, food, these are all, things that change. And so I give recommendations for each season for a 7-day reset. And but these are the kinds of things that we want to talk about: reducing toxin exposure and looking at personal care products. These are they're endocrine disrupting chemicals in here that can complicate and worsen hormonal imbalances, because these endocrine disrupting chemicals bind to hormone receptors and really alter the way that hormones function in the body. Our bodies will be thinking that it has things like estrogen when it actually is a toxin that is binding to the receptor. So our body starts behaving differently. So it's important to reduce the exposure and then support the body's detoxification pathways. That's when supplements really come into play. Supplements, herbs and nutrients, they can help support detoxification pathways. They can help support gut health, these gut dysbiosis issues. And there are also herbs and nutrients that specifically help with hormone balance. There are things like ashwagandha, that's an adaptogenic herb that can help with the adrenals. There are things like chaste tree berry that can help with supporting hormonal balance, like progesterone. And there are certain nutrients that our body needs to make hormones. Like, for example, with thyroid, we need iodine, we need tyrosine. And so there are certain supplements that we can do to support the body in getting back this hormonal balance. And there are other supportive therapies too. Chinese herbs can be really helpful, acupuncture, and of course, some of the naturopathic programs offer these therapies for women going through perimenopause, menopause. There's bioidentical hormone replacement therapy. So there are other things that we can do to help support our patients' hormones. And so I don't know, Joanne, if you wanted to come back on for this part about what I love about naturopathic medicine, because I know you love the same things probably.
Thank you. This is really just a chance to share with folks what you like about being an ND and what you're thankful for.
Yeah. So I kind of said some of these as I was going through the presentation. I really love that not only does naturopathic medicine provide short-term benefits, but also long-lasting effects. So a lot of my patients, so I've been in practice for 22 years and certainly seen, so a lot of the people we end up seeing have been to a lot of different practitioners. They've tried a lot of different things. This was my own personal experience as an 11-year-old child and having allergies and skin issues and going to see all these different doctors and just they put me on a medication and I would have adverse reactions or allergic reactions, and maybe it would provide short-term benefit, but it wouldn't last. As soon as I'd stop taking the medication, all the symptoms would come back. But when I finally found a holistic practitioner as a child that my parents took me to, that was when finally we were able to address the root causes. So that was really great. So I think addressing the root causes, having that long lasting effect, optimizing health rather than just managing symptoms. And there are many side benefits rather than side effects. So, of course, there's a lot of conventional medications, you have side effects, and then you have to go on another, people will be put on another medication to manage the side effects. And then next thing you know, there are 5, 6, maybe a dozen different medications the patients will be on. And that just really complicates things. But instead, if you're using a naturopathic approach, you can minimize or maybe even avoid conventional medicines, get people off of conventional medicines that are might be creating a lot of side effects. And a lot of these medications are only meant to be used temporarily, like steroids. And topical steroids can help decrease inflammation with something like eczema, but they come with a number of side effects. And so if we can, the sooner we can get people off of those, the better. And then allowing patients to really be in control of their health, being the CEO of their health, and allowing their doctors and to be teachers and guides, their healthcare team to be more supportive. All right. So for any of those you want to find out more about me, I would love for you guys to check out the Hormone series, the docu-series, our 9-part docu-series. That's the biggest thing. If you can go check something out, we have the trailer of the documentary up now, and it's at Hormone Series. Sorry, this is incorrect on here. hormoneseries.com/trailer. Yeah, that didn't make sense there. hormoneseries.com/trailer. So that's incorrect on the slide. Sorry about that. But you can also find me on social media and also at thespadoctor.com. That's my main website. And we're on all the, Instagram, Facebook, YouTube. So those are places you can find me. And do we want to do some Q&A?
Yeah, can you just go to the next slide for our upcoming events, and then we'll go to the Q&A.
Okay.
Thank you. So we have 2 webinars scheduled. We're talking about pain in July with Dr. Manning, and we'll be discussing autoimmune conditions in October. We have a few more that we're lining up right now, so stay tuned. And if you have any questions about events, you can always email us. Next slide, you can just leave that one up. If you have any questions, this is our contact information. So Dr. Cates, there are a couple questions that have come in. I know you mentioned briefly about PCOS, but would you be able to go into a little bit more detail on this condition? I know that folks who struggle with PCOS have polycystic ovarian syndrome, have oftentimes hormonal concerns, menstrual concerns, skin concerns, weight gain, sometimes body hair, facial hair, etc. And so how would a naturopathic doctor approach a case like this?
Yeah, so PCOS, what we really want to focus on with PCOS is, of course, we want to look at the patient's symptoms because they can really vary. So you named off a bunch of symptoms, but which symptoms does a person have? Do they have all of them? Do they have some of them? We might be catching them early on in their diagnosis. We might be diagnosing them for the first time. So if you catch someone early and they have fewer symptoms, that's going to be one thing versus that they've had it for a long time. You might be talking about multiple layers. And so what we want to do is look at their symptoms along with tests. So I think it's really great to do things like a Dutch hormone test, or I hope it's okay, I'm mentioning a lab name, but that's a common one that a lot of naturopathic doctors use. It's a urine test that looks at hormone levels as well as metabolites. You can also do some, because they're basic labs as well, that blood work can show certain things, especially when looking at things like blood sugar, because we want to also look at how well the insulin levels are functioning and blood sugar balance. So we definitely want to look at blood sugar, and then we also want to look at androgens. So how do we help with that? Really, the approach is a combination of looking at the lifestyle. So what are they eating? What is their lifestyle like? What stress management, all of those things that I mentioned, those are really important to talk about and to address, because I never want to just give someone a bunch of supplements without making sure that their lifestyle is going to support that, because you don't want to just, because people could use natural medicine just like conventional medicine is, which is have a symptom, use this herb or this substance. And that's really not the true naturopathic approach, which is more, how can we support the body? How do we address the root causes? And so we always want to start with lifestyle, diet, and all of those things. So that's always going to be important. One of the biggest things with diet with PCOS, making sure that they're getting enough fiber in their diet, gut health. Gut health is behind so many hormonal imbalances. So we definitely want to support that. And we want to support the blood sugar balance, especially if we do testing and that does, or in the symptoms show that that's a really big issue for someone. We want to address those with certain herbs and nutrients that can help with that. And then also looking at androgen levels, and do we need to support that? So really it's a combination, but that kind of gives you the overall approach.
Thank you so much. There's another question that came in about the difference between bioidentical hormones and HRT. Would you be able to talk about the pros and cons and how they're used?
Yeah. So bioidentical hormones, and I'm so glad you asked, because there's a lot of confusion about bioidentical hormones, and we do talk about this in the docu-series, hormone series. And so what we want to realize about bioidentical hormones is that the name implies what they are. They're molecularly the same as our own. So biomolecularly the same as our own hormones. And this is different than something like a synthetic progesterone, which would be called progestin, or that's typically the synthetic form, which is going to be different than our own, as well as something like Premarin, which it stands for pregnant mare urine, Premarin. And so that's where it comes from. It comes from pregnant mare urine. And so a horse's estrogen is molecularly different than human estrogen, than a woman's estrogen. So our bodies, when it's given something that's foreign, that's not molecularly the same, our bodies just don't know how to process it in the same way. So there have been a number of issues and concerns with synthetic hormones and some of these other forms of hormone replacement therapies. So bioidentical hormones are generally considered safer. I think it's always important to do them with a well-trained practitioner, a naturopathic, such as a naturopathic physician. We do get a lot of training in this. And I do recommend, if this is something you want to do a lot of, that I would do additional training beyond even naturopathic medical school, but you do get a lot of that in naturopathic medical school. I always say that with bioidentical hormones, if there's something that the patient wants to consider, or the practitioner is considering, we always want to make sure that there's a healthy foundation set before starting bioidentical hormones. You want to address these lifestyle factors, look at other ways that you can support the body before just rushing into any kind of hormone replacement therapy.
Thank you so very much. I really appreciate that thorough response. So I think with that, we are going to conclude today's webinar, and just really appreciate your time with us for today. And so thank you so much for joining, all of you in webinar land. And thank you, Dr. Cates, for this wonderful webinar. We're excited for your next steps and looking forward to seeing where you go next. So thank you again, and hope you all have a wonderful day.
Thank you.